Welcome to the Lead Change podcast. I'm your host, Dr. Mary Mulcahey. I'm an orthopedic sports medicine surgeon with a huge interest in contributing to the growth and development of other leaders. On this podcast, we will share stories from many leaders in all medical specialties to understand the skills necessary to be an effective leader. We'll celebrate their success and hear about strategies to overcome hurdles. We will also highlight some of the unique challenges faced by women in medicine who are interested in pursuing leadership positions and the importance of mentorship, sponsorship, and allyship in achieving and being successful in those roles. Let's work together, build on shared experiences, learn from those before us, and use these lessons to propel us forward in our career. Let's lead change. Hi, everyone. Welcome to the Lead Change podcast. I am truly honored to have Dr. David Dejour as our guest today. Dr. Dejour is head director and founder of the Lyon Ortho Clinic. He is globally recognized for his pioneering research on the patellofemoral joint, knee ACL, and patellofemoral joint in degenerative knees. He served as the president of the Lyon School of Knee Surgery from 2010 to 2012. He was president of the European Society of Sport and Knee Arthroscopy, also known as ESSKA, from 2018 to 2020, and held positions on the board of the Francophone Arthroscopy Society, which is SFA, and the French National Society. In recognition of his work on patellofemoral disorders and orthopaedics, he received a lifetime award from the Patellofemoral Foundation. Dr. Dejour enjoys training residents and fellows and having surgeons visit from all over the world. David was one of our hosts in Lyon, France, as part of the AOSSM Traveling Fellowship to Europe in 2022. He was a very gracious host, and it was wonderful to see him in the OR and to meet and work with many of his colleagues in Lyon. Since then, we've crossed paths at numerous national and international meetings. He is a tremendous mentor and colleague, and I'm so excited to discuss some of his leadership roles and to have him share some of the lessons he has learned throughout his career. So, David, welcome to the podcast. Thank you so much for being here.
Oh, Mary, thank you so much for this very nice introduction. And I'm ready to speak with you and discuss about leadership.
Great. Thank you. Before we dive in to some of your specific leadership roles, can you just share with everyone a little bit about your clinical practice and some of the areas that are of highest interest to you and where your expertise really lies?
So my expertise is knee surgery. And in Europe, in France, we mostly go from sports medicine to degenerative. So I do everything around the knee. I do probably 2/3 of sports medicine with a lot of ACLs and a lot of patellofemoral joint surgery, of course, but I also do quite a lot of osteotomies and total knee or uni replacement for knee. And I love the fact to do both sports medicine and degenerative.
Yeah, it is. It's a very nice mix. And it's something that I've learned over the past several years, really interacting a lot with my international colleagues, you and other surgeons that I met on the AOSSM Traveling Fellowship and through ESSKA and ESSKA, and really understanding the differences between sports medicine training and practice in the United States and outside of the United States. And that in Europe and South America, a lot of sports medicine surgeons really are largely focused on the knee. And so that has been very sort of educational for me. So you were president of ESSKA from 2018 to 2020. So huge congratulations. That is amazing. And your impact on ESSKA has been tremendous. But for our listeners who may not be familiar with ESSKA, can you explain what that organization is?
ESSKA. I love ESSKA, and it is probably the best part of my professional career. And it has been a great honor for me to lead this society. This society is a sports medicine society, arthroscopy society, but mostly focused on the knee. But we go to look at other joints like elbow, like ankle, like wrist, sometimes hip also. And this is the strength of this society. It's the biggest society in Europe, definitely. But I would say that it's a worldwide society because we have a lot of members from outside Europe. In our meetings, we have also something like 30 or 40% of people outside from Europe. So it's a global society, even if it's a European one. What is great with this is that we really want to bring the members and the participants of our meetings the European way to treat patients. Probably it's a little bit different from the US, from Asian Pacific, but we have definitely some great and big connections, and we have a lot of American people coming in as a faculty, as a participant, and people all over the world. So ESSKA has this power, this strength of mixing people and being very close to its members. And we want the faculty, the board members, the presidential line to be able to discuss with everybody during the meeting, during our Congress. And this is, we call that the ESSKA spirit. And this is very strong to me.
Yeah, I thank you so much for sharing that. And having only attended ESSKA once, for myself, that was in 2022 at the end of our traveling fellowship. I would say,
This
like,
is not enough. You have to come back.
I know, I am. I will be there.
Every 2 years.
I know. I will be there in 26 in Prague, I promise. But I had a wonderful experience, and I felt that spirit of ESSKA. It is very strong. And I will say, too, that ESSKA knows how to have a lot of fun and bring on a lot of great education at the same time. So that was a tremendous meeting, and I really look forward to attending again.
Yes, and the other strength of ESSKA is definitely education, because this is the role of a scientific society. We worked a lot doing all about cadaver courses. We worked a lot on making a core curriculum, and we worked a lot on doing a European certification in different fields. And this is something very special to ESSKA. There is probably not so many other scientific societies doing that. It is really successful, and a lot of people love that. And a lot of people join us because of this educational part. And this is something that we have accomplished in the recent years, and we are very proud of that.
Yeah, I think that has been exceptional. And I mean, I get all of my updates. I joke, but this is actually reality that I get a lot of my updates on social media. And I see what ESSKA posts and the certifications. And I think that's really incredible. And in the United States, we don't have that within our sports medicine societies. So I think ESSKA really is setting the precedent for those certification type programs. So congratulations to you guys for doing that. So these are things that have happened in the past couple of years. I know there probably was a lot of work leading up to that, but during your 2 years as president from 2018 to 2020, what were some of the main initiatives that you were able to help implement or carry forward as president of ESSKA?
First of all, I would say that being a president is for 2 years, but you get the second vice president position, you get the first vice president position. So what is really important in leadership is not to come and say, I will do that, and I will definitely change what is already done, and I will do new things. And you have to build that over the years, and it takes time. You need to have good relationship in the presidential line. You need to have a good relationship with your board, and you need to have a strategic plan for the society, not for 2 years, but for 4 years or 6 years, or sometimes more. When I come up as a president, I had Roman Zile before. Then it was me, then it was Jacques Ménétré, and we built definitely a plan for at least 6 years. So during my presidency and the Jacques presidency and the Roman Zile presidency, and then Roland Becker, who take the lead after that, and Juan Carlos Monlau now, we built up this educational program with all the courses, with the core curriculum, with the certification. For my time, I would say that I'm very proud of one thing is when we created Women in ESSKA in 2018, 2019, and this was probably my initiative somewhere. And this is something which I am very proud of it, because we were the first in the scientific societies, even in the companies, because the companies go on with this diversity program. And it's something very strong, and I'm really happy about that.
No, that is all fantastic. And I was actually going to ask you separately about the Women in ESSKA initiative. So I'm glad that you brought that up. Why was it so important to you to help move that forward?
It has been very important to me, probably for one main reason, is that I'm mostly known in the patellofemoral joint, and I definitely did all my career with an American lady, Lisa Elizabeth Arendt, that you know very well. And we discussed a lot about patellofemoral joint, but also about the relationship between males and females in the orthopedic world. And I was sensible to this. And I knew more about the Ruth Jackson Society, which was founded in 1982. So it's a long, long time ago. And so this is probably what I like me about that topic. So when I was ESSKA president, I wanted to have a woman in my board. And I asked many women who were on the top if they wanted to join the board. And at that time, it has been impossible to have one in the board. They were maybe shy or say, well, maybe I will not have time. So it was tough. And I say, but we need to promote and to say and to show that it's possible for a woman to be in a board of a big society like us. And that's why we created that. And after this, I had 3 women in the board, and the second vice is a woman who is a Bertebo. And I'm very happy about that. And we are very happy with this. You have done yourself in US with AOSSM. You had many women in the top management of your society, and as also as a president. And I think it's very important to highlight that.
Yes, I agree. I'm glad that you brought all of that up. And I absolutely love Berta. She's one of my closest friends. I met her on the traveling fellowship too, and she's amazing. And I can't wait to see all the things that continue to happen with ESSKA as she rises up in leadership and assumes the presidential role in just a year or so.
And we have we have also now a mentorship program for women, which is really good because we have a traveling fellowship. You know about that, and it works super well. And the goal is definitely not to put males and female against. It's just to say, wow, we all together, and we will all work together, and that's great.
I think the mentorship program has been well received and really has been kind of evolving, especially in these past 2 years. And I'm very excited to share, just since you brought it up, that I will be hosting 2 European surgeons as a mentor as part of ESSKA sometime between probably September and December of this year. So I'm very, very excited to be part of this. I did want to ask you, you have touched too a little bit on the traveling fellowship. I mean, I mentioned obviously how I first met you through the AOSSM to ESSKA Traveling Fellowship. Well, you have also served as the godfather for ESSKA to AOSSM, the Traveling Fellowship, actually in the summer of 2022, when you traveled with 3 female sports medicine surgeons from Europe to several sites in the United States. And I believe that this was the first time that all 3 traveling fellows from Europe were women. I know them all very well. They are incredible. So I wonder, from your perspective, what was the experience like as a godfather traveling with these three exceptional surgeons and visiting all of these sites in the United States?
Mm-hmm. Yeah, this traveling fellowship between ESSKA and AOSSM is something so strong. And this is the highlight of the fellowships, definitely for ESSKA, at least, for sure. And I did it as a fellow in 2003, so a long, long time ago. And I have been really honored to be the godfather of this traveling fellowship in 2022. And the selection to be a fellow is really tough. It used to be with the people with the network, blah blah blah. But nowadays it's definitely not that at all. And the rating is very tough. The rating is done on your CV, on your publications, on the peer review publications, and your involvement in the different scientific societies. So when the selection was done in 2022, we had three women, but the three women were not because they were women, they were because they were the best, definitely. And
Exactly.
I was super happy to have three women with me, definitely. And everybody said, "Well, David, it's because you are David and you pick up your ladies." I said, "No, no, no, I never pick up anybody." It was a blind rating. So this is very important. And we had an amazing traveling fellowship together. But frankly, I never seen them as a ladies or female or whatever. I seen them as friends, fellows, surgeons. I liked fellows and I liked surgeons, orthopedic surgeons. And it was really cool and very simple, in fact.
That is awesome. I'm sure it was just wonderful. And I was following the trip as you all traveled through the United States, and certainly I have continued to interact with the three of them as well quite frequently. So
But I was really happy because everybody said, "Oh, you are so lucky." Of
I
course.
think that
And
they
I was
felt
really lucky,
they
definitely.
they felt very fortunate to travel with you and learn from you too. I know that. Um, Before we dive a little bit more into some specific leadership roles, I wonder, have there been any pivotal moments in your career that have really helped shape who you are as a leader?
I would say the first probably for me, you know that my father was a very big surgeon, orthopedic surgeon in Lyon, very famous, number one. And it was a little bit tough for me because I was the son of, and I had the same name, Dejour, but I had no surname. And it has been a little bit difficult for me, definitely. And I had to fight for that. But I was happy to do that. So my biggest mentor was also my father, definitely. And I did a traveling a fellowship, a U.S. fellowship for almost 1 year in 1993. And it was definitely a big pivoting moment in my life because, first of all, I start to speak English, not too badly. And I met a lot of people and I did some networking, definitely. And I was really happy to present the work that we were doing in Lyon. And at that time, the French were not speaking too much English. They were not publishing in English. But I had slides, and in the different places where I've been, sometimes they asked me to present what we were doing in Lyon, and especially in Pittsburgh with Freddie Fu, and in the staff in the morning, they asked me, "What are you doing in ACL? What are you doing in patellofemoral joint?" I came with my slides, my carousel at that time, no computer, and it's really changed my life for this. I met Stefano Zaffanini, who was a fellow in Pittsburgh too, and we were like close brothers for life. And then I started to be invited in some American meeting, which is a great honor and which is not very frequent for French. So that was it was very important for me. And the second would be that I've been involved in different boards of scientific society, the French Arthroscopy Society, the SFA. And I was in that board, and I was really happy because I had some work to do outside Lyon, because Lyon is a city and we are all together. And we were mostly doing things in Paris. So I was doing things outside my town, and progressively I got my surname David also. It helped me a lot, and I have seen that this society was really inclusive, was really interesting, and I was able to do things. I had another experience in a national board of our national society, where in that board nobody was able to speak, and we had the presidential line, and everything was said before. And I understood that this is not the right way to do when you deal with a board or when you want to lead a society, because you need to include your board, you need to give some responsibilities to everybody, and you need to ask people to come and to propose things and to be interactive. So I say I will never lead a board like that. Big pivoting moment in my life. In my group, the Lyon Ortho Clinic group in Lyon, which was growing. It's a private group, so there is no real hierarchy, but I am the founder, and I'm somewhere the head of that group. I felt that I need to get some tips, tricks to lead it, because sometimes you have some ideas and the people don't follow you. So how to deal with that? I say I have to do something, and I went in a business school in Lausanne, IMD, to do a leadership program. It has been really fantastic for me. It was immersive for 3 weeks without any contact, outside contact. And I thought that I would get some rules, some lesson to how to be a good leader. And in fact, during that time, we never had any courses, lesson or whatever, but we spoke a lot about ourselves. and, and it was the best way to understand who you are. And if you know exactly who you are, what are your strengths, what are your weakness, your vulnerability, you are more able to deal with, and you are more able to probably lead a group. And it has been really interesting, and for me, it was great. When we do every 2 years a strategic meeting in ESSKA for the board, we did a course with this business school for my strategic meeting, just to explain people how do you interact with people, how could you be not aggressive but inclusive, and try to make your big machine, because it's a big machine, going in one way.
Wow, you brought up so many incredible points and so many different things that have been pivotal in your career, many of which I didn't know about at all. Of course, I have heard about your father being such a huge impact on orthopedics, but you have had an enormous impact on the field, on sports medicine, on orthopedics as a whole. And so it was very interesting to hear kind of those early years of what that experience was like for you as you were practicing with your father, and that he was such a great mentor for you, and how you learned so much, but really had to grow and build your own name. And that initially really it just was, you had Dejour, but not David, and that it took really quite a while of publications and presentations and being involved for you then to have your full name. So I love how you laid that out for us. And your involvement in the French Arthroscopy Society. I was going to bring that up as well. So I'm glad that you did. I did want to ask you, you touched on, the Lyon School of Knee Surgery, where you are now. So where you have been your career, and you founded that group. So and this leadership structure that you created. So you were the first president of the group. But I wonder, even for people on this who are listening to the podcast who may not be familiar with the Lyon School of Knee Surgery, just explain a little bit about what your group is, how it's so special, and what were some of the leadership skills that you took from serving as the first president and founding that group.
So I have to correct you a little bit because
Please.
I didn't founded it. This Lyon School of Knee Surgery has been funded in 1971
Wow.
by Albert Tria and my father. The goal was, so at that time, the knee surgery was very small. And at that time, they decided to do a meeting, a biannual meeting, so every 2 years, about knee. And the goal was to bring the results of what was done in the university hospital, because at that time it was mostly university hospital. So look at the patient, see them back, look at the result and say it's good or it's bad. We did that and it's fantastic or it's not fantastic. So this meeting started small and becoming big, and especially mostly in France because it's a French meeting. And this is the motto of this association, because it's an association where we look at our patient, we do some work together, and we give honestly the results of what we are doing. The other thing which is really strong in this association is that we work both private and public. So the university hospital and the private hospitals work together in the same way. And this is probably the best way for us in Lyon, where you have very strong groups in orthopedic surgery, to be all together and not to fight. So this is the story, and so I have been a president of this society in 2012, I think. But we had Pierre Chambas before, Philippe Néret, Michel Bonin, Elvire Servien, Sébastien Lustig, and others. And this is definitely the big strength of Lyon, because when you live in Chicago, you don't know that there are three big groups in Lyon. You see only Lyon, and you know that everybody seems to work together. We are not working together, but definitely we all talk together, and we all try to be gentle and try to highlight what we're doing. So this is definitely something very important. We do a meeting every 2 years. We take a focus. So the last one was about ACL, and we had 1,200 people in our meeting. So it's probably the biggest meeting in the world on about ACL. We did on patellofemoral joint 3 times. We do some degenerative also meeting, focus on uni, osteotomies, total knee arthroplasty. So this is the best way to explore the knee pathology. And if you want to speak a little bit about patellofemoral joint, everything was discovered in 1987 by my father and Gilles Valch at that time, because this meeting was only focused on patellofemoral joint. And this is where they discover the crossing sign, the trochlear dysplasia, the TTTG, and all that stuff, because they look only at that topic. So it's definitely super strong.
Yeah, that's amazing. Thank you so much for telling us the history, the very strong and rich history of the Lyon School of Knee Surgery. And it was wonderful from our perspective, too, to have a chance to visit for a few days, to learn a little bit, to meet some of the people and actually see the cases, see the facilities. So thank you for sharing. And, you have clearly held numerous very important leadership roles within and outside of your institution, outside of France, in sports medicine societies, on committees. And with all of these things, of course, comes great responsibility and a lot of associated work. But along those lines, what motivates you to be involved in all of these different things?
First of all, what makes me so happy all the time is to teach my resident, because we have some resident in my hospital, to teach fellows who come from all over the world. And those young surgeons are definitely my greatest pleasure in life, because they come, they are pretty good, but you give them something which will definitely change their lives in terms of surgery with your hands, and you know that hands are very important, even with a robot, with the way of dealing with the patient in consultation, which is very important, how to listen to the patient, how to use the words that the patient are using to explain you the pain they have, and also to give them the way to screen a patient, to look at, to listen to the history, to make a very clear clinical exam, always the same way, to look at X-rays, to measure X-rays, to look at the other imaging data and to measure them, and to get a diagnosis, and finally to plan the surgery. And then the things are done when you come up just before surgery, because everything should be planned before surgery, and the surgery is just a technical part of your job. So this is something that I really love. What I love also is that it stimulates me a lot, because they are always challenging. The young surgeons, they want to fight a little bit to say, why you say that, is that true? Oh, okay, just look at that, and we will do a study with that. We will publish that, and definitely, I'm super happy to have a lot of sons and a lot of daughters now, because we have more and more ladies in that field. This is something which drives me. The other thing is that in the knee pathology, what I love is to be creative, and I love to look at my data, but I hate to say, wow, now I'm doing that technique, and since I'm doing that technique, I have so good results. I don't like that. I prefer to look at why you have that pathology, and it comes probably from the patellofemoral joint history, where we it's something difficult. They have pain, they have dislocation or whatever. But if you look at X-rays, if you look at MRI, if you measure, you will understand more which category of patient you have. And you can do that in ACL, for example. We worked a lot about the tibial slope, the static anterior tibial translation, and it is exactly the same way to think. In Lyon, we say the menu à la carte. It means that you have some different ingredients, and with these ingredients, you will have a recipe, and your recipe will be definitely mostly successful most of the time. This is what leads me definitely, and then I'm happy to show that in the meeting. I'm happy to see my fellows or my residents presenting the work we have done in meetings. I'm super proud of that.
Yeah, it is wonderful to see them, and I'm sure they have such an amazing experience spending that, whether it's several months or a full year working with you, learning from you, and then just as you said, they become family, right? That
Mhm.
relationship lasts forever, and you continue to support them, work with them, and as you said, just being so proud to see them up on the podium and publishing and presenting.
I love to teach them also how to speak, how to behave with your audience in front of you. It's very important. And in my OR, most of the time I have some foreign visitors in my OR, and they have to present the case in English. They have to show how they do. So it's very challenging for them. But at the end, they are pretty confident with themselves.
Yeah, that's huge. And that is, they're getting this experience in a protected environment with you there supporting them. And that helps them tremendously in their career as they move forward and then are very likely involved in this is, sports medicine and other societies within France, within Europe, and then outside of Europe. And so it gives them a very important skill set. So you're helping them tremendously with that as well. And
Sure.
and I wonder, David, what would you describe as being one of your biggest strengths that really contributes to your success and sets you apart from others?
My big strength, to have big strength, first of all, you need to have done some publication if you have proof that what you are talking about is not blah, 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 but it is something really strong, is the first step. So with this, and if you are lucky to have some highlight publications or highlight topics in your bag, it's good. And then what I have is that I try to use my sense of humor, which is something that I use a lot, definitely. And this is a good way to present and to bring the people with you. But it's not only a show. It's you could make the show. You could do the show if you have something really inside of what you have done. So it's not only a show. This will enhance what you have done as a scientific work. This is definitely my strength. I would say that also I know pretty well my weakness, and so I can deal with them. And I know how to manage that definitely.
Yeah, I think that's so important. You bring up, strengths, also understanding your weaknesses, areas that we can work on. But I would say of the strengths, I mean, I agree with all of those, knowing you just for these few years, but having to gotten to know you fairly well. But I will say, certainly, I feel like your humor and how you use that so effectively is just incredible to engage the audience, to engage whether you're speaking one-on-one to someone or speaking to a larger group, how you engage everyone, but still just provide exceptional education and just teaching and on very complex topics. So I think that is a tremendous strength. As one final question for you, David, I wonder, do you have any specific advice to sports medicine surgeons or physicians in general, for that matter, who may be interested in pursuing different leadership roles throughout their career?
I would say, Mary, always speak with flowers to, to everybody. No, I would say that just engage yourself in what you're doing, and if you are interested in one field, just go and work on that. And it 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 is highly demanding. It takes time. It takes time on your personal time, on your family time, or your friends' time. But work on it and go 100%, 100% anytime you are at work, and then you can do some other things.
Yeah.
But we are so lucky to have such a great work job. It's fantastic.
Yeah, no, you're absolutely right. And that's such great advice. But when you are doing something that you love, as you're saying, it doesn't feel like work. But
No,
certainly to immerse yourself and be engaged in the things that you're passionate about, and then these opportunities will present themselves, but also, right, working very hard. You do have to put the work in. And so I appreciate that advice. But David, thank you so much for being here, for being on the podcast. I really, really appreciate it. It has been wonderful talking to you and hearing so much about your different leadership roles and your experience, and to have you share all of this great advice with everyone.
I loved it. Thank you so much for inviting me.
Great. Thank you. I look forward to
Bye
seeing
bye,
you
Mary.
sometime soon.
Thank you. Thank you. Bye bye.